welcome, Dr. Kaplan. This has been a long time in the making, and just super appreciative of your time today, and more so our friendship over the years, and just thought of you just in terms of your experiences, and we'll get into kind of your background and what those are, but how relevant they are to the orthopedic community and the community that we work in every day, and just appreciative to have your time and insights today. So, welcome.
Pleasure. Yeah, thank you, Scott. I enjoy doing things like this. I think it's important to speak out, and of course our relationship and with WRS and Kevin Odell has been a wonderful privilege for me, not just because I like you guys and I do, but it's been very, very much supportive of the care that we render to our patients, the way you've supported our practice and you've joined hands with practices like mine in my state. And I think we're all kind of married to the right purpose, if you will. And I'm grateful for that, because you have to have relationships like this to be able to be impactful in the way in which we deliver care. I think you have to hold hands with industry. It's productive to do so. It's the right and responsible thing to do. And so I am grateful to be part of that, to be able to mature my practice in orthopedics. And so I'm looking forward to this few minutes we have together, and let's fire away and see if I can give you some answers to things that are of interest to you and to the community.
Awesome. I appreciate that, and right back at you. Before we get started, I did want to give your background, because I think it's very relevant in terms of the conversation we'll have today. So you are a board-certified orthopedic surgeon. You specialize in sports medicine, joint replacement, and complex orthopedic care. Over 35 years of clinical experience treating musculoskeletal injuries and degenerative conditions. You did your fellowship under Jimmy Andrews. You've been named a top doctor in Connecticut. You have served on a number of different affiliations, both at the state level and academia. That's super impressive. Served as academic program chairman of the Connecticut Orthopedic Society. I've attended the Orthopedic Society a number of times. I vividly remember coming to your house. I believe it was Senator John Barrasso. On that dinner, I was younger, and it really was an influential experience for me, and always loved coming out to Connecticut for the Connecticut Orthopedic Society. You've also been a professor at Quinnipiac University. You have served as an assistant clinical professor at Yale. You've served on the Connecticut Workers' Compensation Executive Board, which is super relevant to the work we've done over the years. Finally, and selfishly, I think this is super interesting to me, at least. You are the chief medical correspondent for ESPN, and you've worked with the NFL. And like you said, we've known each other for a number of years. We just value the working relationship, but more important, the friendship. Your career is remarkable, and the work that you continue to do is inspiring. And so, we're really looking forward to this discussion, because I do think other practices and orthopedic surgeons can glean relevant and applicable information, to give them direction from your experiences. And I remember when we first started working together, I think you just mentioned it, it was really clear that we are aligned philosophically. We both want to take a long-term approach, only provide what is clinically beneficial to the patient, equally consider the payer's needs without adding unnecessary costs. And I'm just also very impressed at how you balance running a private orthopedic practice, which is a business, but also you're at heart a clinician, a great surgeon, and so that balance to me and the way you do it has just been super thoughtful and proven to be really effective. So appreciate your time today, and we can jump right in. So the last thing I mentioned is the first thing I just wanted to talk about. Obviously, I love sports. Through our sports-focused cold heat contrast therapy compression technology, Proventus. I've been able to spend some more time recently with sports teams and athletes and looking at those their needs of recovery and injury pathology. And it's obviously the sexy part of orthopedics, but I'd love to hear more about your experience working with ESPN and subsequent to that, your experience in treating elite athletes.
Sure. I think it's a good place for us to start, Kevin. So, Scott, sorry, Kevin's my other half of this WRS.
Well, yeah, he's my better half. So
no, I wouldn't say that, but you're equally impressive. So I trained, as you mentioned, with Jim Andrews, who's really one of the icons in sports medicine care. And I think it's, as a clinician, good to have mentors, people that you look to, you respect, that help guide you, not just in your expertise in delivering care as a surgeon, the rapport you have with patients, but also that balance that I think is so important you mentioned, to be able to have a sense of self where you take care of yourself, frankly, because you're no good to anybody if you're not taking care of yourself. Exercise, nutrition, what have you, that makes you feel whole. For me, a big part of that balance is family, as you well know, with a wife and 5 children, and that keeps me sane and happy, motivates me. But the work itself, I think, is very, very important that you get gratification, that you have your well-being, if you will, by caring for patients. I think that's the greatest joy, is to help others. It's not something I originated, but I bought into. My dad was a surgeon. One of my older brothers is a surgeon, but it's really a privilege to be able to have that kind of obligation too, to be able to render care to another person, to serve them and their welfare is a tremendous privilege, and with it, an obligation that you have to meet seriously, and be able to usher care objectively and yet buy in enough to make a difference, meaning they have to touch you and you touch them emotionally, physically, and that makes you, I think, a better clinician. And it's harder to do now than it was when I started, I think, and maybe harder for me than it was my dad. There still is tremendous respect for doctors, and I think appropriately so. But maybe in the last 20 years, we've lost a lot of our autonomy with venture care and big hospital systems sort of running practices, and with it taking away some of the bounty, if you will, of what we do, running a business and being responsible just to the patient, if you will, not to a governing body. So that it's harder for the young people coming out. They're more accustomed to working certain hours and being in a job like many other jobs where you put in your time and you're done. And that individual owned practice is a rarity, and I think that's unfortunate. Big businesses made a lot of money on the backs of medicine. It's been found out, but you still can be a private practitioner, and even if you're not, you can still have the right priorities, which I hope most do. I mean, there are easier ways to make money than to go into medicine. I think of my 5 children, maybe one will. But if you choose to, it's a tremendously rewarding thing to do. I go to work happy and come back to a home happy and never feel like I've wasted the day. And I think that's something to be grateful for. Not everyone can say that. Anyhow, so with Jim Andrews, that was a long-winded entree, but Jim Andrews was one of the biggest players nationally in sports, and I got to work with him closely for a year and maintained that relationship even to this day. And then early on in my career was lucky enough to get involved with the San Diego Chargers as one of their physicians. So I traveled for 2 years with them under a very wonderful physician, Gary Losey, who's since passed. And then I think because I'm in Connecticut and started caring for some of the executives at ESPN, got involved there. I saw Sanjay Gupta making decisions on CNN and thought, geez, there really should be a doc unbiased who understands what sports injuries are and give that insight to the public rather than just a sportscaster, if you will. So that was a very fun thing. ESPN is 20 minutes from my office. And for 13 years, I was their senior medical correspondent. Spent a lot of time going there on Sports Center and on the phone. And I learned a lot about a different part of medicine, if you will. So the media is important, and it was a different perspective and taught me a little bit how to think, looking at a camera and answering questions, not just as we would in the office or to a sophisticated group when you're lecturing to other orthopedic surgeons. So that was a very valuable thing and helped me in my career in many ways. And I feel very blessed to have been able to do it. So that's how I've been, if you will, out there, and it's given me entree even to more audience. I was the first orthopedic surgeon in 200 years to give the keynote at my medical school, which is a rarity. And I think because ESPN launched me in that regard. But I'm a busy clinician and have always been. So I sort of lateral, if you will, my practice to do some other things, including education, which I'm a preceptor to a medical student, part of a traveling fellowship. And I think that's very important to teach the next generation how to be good doctors, good surgeons. So I'm active in that. And then, as you've alluded in your note to me, I have had relationships with industry, which I think is also very necessary because we know best delivering the care, what's important. And I think partnering with various industries is essential to move the needle for care. And no one should be embarrassed about it if it's done in a equitable and transparent way. And I think I've done that and many others too. So I'm a knee and shoulder guy. I do mostly knee now, and I've sort of evolved into an arthroplasty surgeon, having done 30 years of sports medicine. And so I do a lot of replacements, but I still do a lot of ACLs and arthroscopic work and care for athletes. I take care of local college and high schools. And I do probably 30% shoulder. I have a wonderful colleague of mine who's doing more of the shoulder now. He's probably the best fellow and resident I ever have seen come out of Yale in special surgery. So he's doing a large part of the shoulder, and we all become so specialized. We have a hand guy who does just that. So the general orthopedist is no longer as relevant. I'm sure there are parts of the country and certainly parts of the world where you do general orthopedics, and sports medicine is to a degree general orthopedics. So again, a long-winded answer about what I do, and I'm very grateful to be able to still do it and hopefully do it for a fair quotient of time further.
So great. Yeah, I love it. And my next question is just around private practice and the different patient mixes. It was fascinating to me when we first met of your work on at the state level from a workers' compensation perspective. Our company WRS kind of started, with that focus. We've now branched out, and as of December 1st, we actually finalized our acquisition of the Game Ready orthopedic rental business. So we have ambition to make cold compression therapy the standard of care post-operative orthopedics, period, in the United States. We've taken some headway there in terms of the NOPAIN Act with a specific Medicare reimbursable code for Game Ready. And so we're excited to go down that path and kind of carry the torch. We've really put our eggs in that basket. We think cold compression therapy is such a great modality and clinically beneficial. And I know, we've worked with you for a number of years with your patients. Going back to the workers' compensation side, what differences to you as a clinician in terms of working with injured workers, and how does that fit in? And it's a leading question because if you were to do a study, I think in orthopedics, and you wanted the optimum outcome, and you could eliminate a payer profile, you'd probably pick work comp, as the general consensus. And there's additional middlemen and paperwork and, just bureaucracy that's associated with, workers' compensation being a legal system, obviously, and a healthcare system. But I'd love to get your take on, just that involvement at the state level and then as a clinician with injured workers.
Yeah, I think it's a good question, Scott, because I know that many people share that a workers' comp population can be challenging. There can be secondary gain issues that you meet and have to dial yourself back and say, this is another person, a human being who's hurt and needs attention. Just like there are all other walks of life, we still take care of state patients, Medicaid patients who need care and may not be as practice efficient, if you will. And that was something taught to me by my mentors, including my father. But the workers' comp piece is very necessary. Our industry as a country has to keep well, and we've learned a lot in preventative and also post-operative care, and that's where WRS and cold compression have really made a difference. We make strides in the way in which we operate or do our surgical procedures. So we've come along a lot. We used to do a total joint. You'd come in 2 days before and stay for 2 weeks. Now you come in an hour before and mostly go home. And yeah, there have been tremendous advantages with technique and opportunities technologically. But I think maybe the biggest gains we've made are with regard to caring for the patient before and after a surgical procedure. So getting a patient ready for an operation, making sure they're fit, they understand the home environment, they're committed to their own recovery, and then lessening swelling, inflammation post-operatively, taking away the burden of narcotics, as you guys have aptly done, way ahead of most, where that in itself becomes not only sometimes dangerous for the patient, but can be a disincentive to do well. If you look at studies, those that are on long-term opiates, they just don't fare as well after surgery. And so if you can minimize swelling, rest the joint, do cold compression, elevation, all the other non-opioid medicines that are necessary, and physical therapy, which has been a tremendous benefit, get them supported with the bracings they need, get them back and motivated to be recovered and conditioned, everybody wins. The patient first, but also society. It's a much less costly affair. And medicine and medical care is a big quotient of our GDP. And we have to be careful to use those resources because they're not unbounded. And so I think we've made very good gains in our society to prepare people to be healthier and live longer and take better care of themselves. And then if they need an operation, they understand what it means and how to get well. And joining hands with people like you and WRS and cold compression has been very useful to me and to my patients, and afforded us opportunity to rely less on things like narcotics and keeping patients immobile as we used to years ago, getting them back to the workforce, which is your first part of your question. I mean, the biggest expense in workers' comp is not the operation, the doctor, the hospital, it's the time away from work. So if you look at what costs our society, it's from the injury to when they get back. And if they don't get back in a certain quotient of time, certainly by 9 months, they'll never go back. But if you can get people back to work relatively quickly, if they enjoy their work, you understand the work environment, you get them back safely, the cost to our society is considerably less, and psychologically to the patient. Most people want to get back and be productive. I mean, it's hard to be happy if you're not engaged, and work is a big part of that. So I think that's an important thing as a physician to do, to give care to the injured, also those in the workplace, and respect that these businesses need their workers. They have to be kind to them and supportive, but they need them back. And I think as a doc, that's another part of our obligation to do that and do it well. And that's why for 30 years almost. I've been on the executive committee for the workers' comp. It's just one of the things I think we should do. And a lot of injury is musculoskeletal in nature, obviously.
Sure. Yeah. And I just find it that obviously with AI is kind of everywhere, and I do think obviously it's going to revolutionize a lot. But what you hear is it's digital, not physical, and so there's going to be more, I think, opportunities and just influence from people that work with their hands and actually physically show up and do things and kind of keep our country running and make things and build things and fix things and so we're really proud to help support the American workforce, and you've been leading the charge not just by the things you say but your actions as well. And I would say this too, like, you have just made our company better in terms of the rigor that you apply, the questions that you ask, in terms of how we work with practices, because we've worked together a long time, and everything you do is thoughtful. You really care about the way in which you're working with all the stakeholders in medicine. It's become very clear, and so I just want to thank you for that. We're now working with some of the largest high-image orthopedic practices in the country, and we have a scalable solution now that I think appropriately always meets regulatory compliance demands, but also is the right thing to do for the patient. But as you mentioned, in terms of private practices, I don't think ancillary business opportunities are a luxury or even ancillary anymore by definition. It's almost mandatory because of the consolidation and kind of all the things you mentioned that are happening in healthcare, and all the advantages that larger corporations and health systems have in terms of all of those ancillary solutions that are being provided. And so, orthopedic surgeons, Kevin Odell and myself kind of grew up in orthopedics on the industry side. We spent a number of years on the device side of the business as well. And you guys are all our friends, and you said it best, like the commitment that it takes to be a surgeon, just from a time perspective, into your 30s before you're actually out generating income, is a huge sacrifice. And we should reward physicians for their specialty and the value that they provide in our society, or our smartest people aren't going to want to go into medicine, which is certainly a shame. So we're proud to work with practices like yours. Could you talk a little bit about that in terms of running a private orthopedic practice, and the ancillary programs? Certainly we've had a successful business relationship providing management services to your practice. I would say we have the only point of care cold compression therapy program for rented cold compression therapy. You mentioned kind of this multimodal approach. That's the view that we look at everything through in the post-operative sense. And so we've married that with a non-opioid generic medication pharmacy program, all from reputable manufacturers, all clinically beneficial medications. And we've just seen that be super effective and feasible with the constraints that practices all have in terms of space and people. But love to have you share your just experience in running a private practice, and kind of how that, you've already mentioned how that's evolved quite a bit over the years, but the challenges that you face and how these types of programs are effective in your overall business approach.
Okay, Scott, well, I think your approach is a healthy one, and you've been in the OR and worked with surgeons and doctors, so you came to it with an advantage that if you hold hands and do things together, both parties are more successful that is the physician and the so-called ancillary support. And that's very necessary. I mean, we can't do everything alone. You have to have colleagues and people you trust as we trust each other. The private practice piece, as you also alluded, it's essential to have these other opportunities where you're sharing in their care and deriving income for it, because staying above water in private practice is more and more of a challenge as reimbursements go down, costs of delivering care go up, not just for hospitals, but for practices. It costs us more to keep people employed in our practice, to be able to deliver high quality of care. And there's only so much hours and attention you can give as a one person, or then as a small private practice. We're 3 surgeons and a few other PAs. But I think the ancillary pieces, the ways in which you can help support care with therapy, with cold compression, with medicines, and if it's done in a way in which it's honorable, as you have, everybody wins. The patient, for sure, the practitioners in the practice, and those quality industries like yours. And so I think it's very important that young clinicians understand that they're not put off by relationships. They should be encouraged to do them, just as they should be encouraged to take part in teaching and affiliation with universities and state societies. This is all part of the package of carrying the torch, if you will. And yeah, it's a lot of work. I trained 10 years after college before I was ready to begin a private practice. So you have to put a lot of your life on hold, if you will. And as rigorous as it is now, it was more rigorous even then when you didn't have capped hours. But for me, I would do it all again in a heartbeat, because it's just tremendously rewarding. It's, as I alluded to before, it's just an honor to do it. And you feel good about yourself and helping others. And all these other parts of the practice, whether it's in a university or even working for a corporation, a VC group, as a lot of young people coming out do, you still have to go back to the basics where you enjoy the interchange with another person. You realize that what you're doing for them is so important to their welfare, their life and limb, and their future. And you take it seriously enough that you're wholly committed to it. So having partners out there is necessary, colleagues you trust, institutions you trust, and business like yours that's honorable and well-intended and thinks forward and long-term, like you also mentioned. That's very, very necessary. Nothing about this is a quick fix. You have to have some ideal of delayed gratification, if you will, and you put your head down, you do good work, you're all going to be successful.
You've made my job very easy today.
We've been dancing together for a while.
You're the best. Again, now that we kind of sit down formally and review this, like the impact that you've made in all of your communities, locally, the orthopedic community, I think you beautifully and eloquently kind of addressed, ultimately what, fulfillment is, and the fulfillment you get and the joy you get from what you do, which, if you don't enjoy the journey, that's what life is. And I think a lot of, surgeons can glean, a lot from that, of giving, you get what you give. And, the fact that you're still working with the younger generation, you're still involved at the state level with the Orthopedic Society, with the Work Comp Board, it's just a fascinating career. Congratulations on everything you've accomplished up until this point. And we're super appreciative for the opportunity to work with you, more appreciative of our friendship, and we wish you the best
you.
moving forward, and I can't wait to get back out to Connecticut.
Thanks, Scott. You're always welcome here. You're a good man, and let's keep moving forward. Andrews used to say, if you're not moving forward and you're stagnant, you really shouldn't be still out there because you're losing ground. And so you guys are doing that. You've always done it since the 20 years I've known you. And so we're proud of each other, and let's keep the torch lit.
Love it. Yeah, thank you so much for your time today.
My pleasure. Have a good afternoon.
Yes.